a friend and very inspiring woman that I have the privilege of working with. She was one of the masterminds behind the Collegiate Recovery Grant that we have. So we owe a lot to Amy and others who wrote this grant to get the network started. So thank you, Amy. Amy Saunders is the managing director of the Center of Excellence for Recovery at Marshall University, where she serves as the chairwoman for the Marshall University Substance Use Recovery Coalition and oversees the implementation of initiatives related to substance use disorder and behavioral health. She's has over 20 years of experience working in this field. She serves on the West Virginia Higher Education Policy Commission Division of Health Sciences Advisory Committee. And I believe Amy serves also on the governor's substance task force.
I do. Thank you, Susie. Can
You're
you all hear
welcome.
me and see my slides okay? I just want to thank Susie Mullins. I've known Susie for a long time. I would say probably 15 years or more. We started working together on college campuses when she was at Davis and Elkins, and she's a wealth of knowledge, and there couldn't be a better person steering the work that's happening in collegiate recovery on throughout the state. So we're very excited and blessed that we have her here. So with all of her expertise. So thank you, and both all of the great presentations this morning. I just kind of really want to have a conversation with you all and a dialogue about medical amnesty. And I'm going to talk a little bit about what it is and some of the processes that we went through at Marshall as we worked on this policy to get this, and kind of why it's important and some things for us to think about as a group. There's a lot of great work, and I was so excited to hear Tom Gadara say that they're going to be working on harm reduction at the federal level. So that's just wonderful news to many of our ears, I'm sure. So we're super excited about all of that. So but again, I want this to be more of a dialogue and a discussion. I'm going to share our policy on here, but really want to talk to this group just kind of and start thinking about things that we can be doing in terms of policy work and looking towards the future to, meet people where they are and provide assistance. So um, first, we're going to talk a little bit about medical amnesty and why it's important. Most folks know that there's over 20 million people in the nation who are experiencing a substance use disorder. And here in Appalachia and in West Virginia, we have even higher rates. So it's really important that we start thinking about ways that we can meet these folks where they are and provide some assistance to them, whether it's kind of as they were speaking about earlier in terms of the prevention field, and we're talking about substance misuse, or if we're talking about people who've actually even developed a substance use disorder, and then, also providing that support for those who are in recovery. So it's really important that we be thinking about this. And college campuses and higher education is a great place for us to be having this conversation because we know that emerging adults, that's that kind of 18 to 25-year-old, have some of the highest rates when we look at alcohol and substance misuse. So we need to be thinking about intervene in there, and I love the discussion around the biennial review and looking at all of those services and ways that we can help people. So we need to be thinking about how we can intervene, and there's lots of different points as they were discussing earlier that we can kind of think about and start to work in there. So, medical amnesty, if you haven't heard about that, is really it provides protection for those who are seeking medical attention for a medical emergency or health issue. There are some places that have state laws. There are some cities or local ordinances that have laws for it, and there are campuses that also have policies for medical amnesty. So it's really important that we think about, you know, this is an intervention. It's a way that we can help people who need to seek medical attention. And the purpose is really to reduce the hesitation or fear that somebody may have in seeking help. And so they're really important policies, or again, they could be in some states laws that are introduced to help people so that they don't are not fearful of seeking help and assistance. So it gives us really a tool in our toolbox. It's really important that we think about this so that we can help people who maybe are using substances or have developed a substance use disorder in a way that we can intervene with them. Um, I like to use this model. This is the continuum of care that we have from the Institutes of Medicine. And as you heard, um, our speaker talking about the biennial review, there's lots of places on this continuum that we can intervene. Um, and one thing I'd like this group to think about, and maybe as we work with Tom and folks at the federal level, is where is harm reduction in this? We need to be having harm reduction added to this model. If we look to other countries, harm reduction is in their model. For example, Canada's done a lot of work adding harm reduction to this model. And we, as a nation, federally, and can start to look at this, adding this to the continuum of care so that we can meet folks who may be in the prevention side or the treatment side or the recovery side, but adding in here harm reduction, I think is an important piece for us to start to think about as well. I'm going to talk a little bit about our history here at Marshall when we started to work on medical amnesty. We had been going around to a lot of conferences and we were starting to hear about some work happening in this area, and institutions were starting to implement these, unfortunately, after they had had usually something, a bad consequence that had happened. A student had, either had alcohol poisoning or had overdosed on prescription drugs. Um, and there was a bad consequence that had happened. And so we were starting to hear some of this at the national level, and we had even heard of some of this in West Virginia as well, and we wanted to try to prevent that. So we started looking really at the literature on medical amnesty policies. We looked around at what other campuses were doing. Um, and started to look at their language and information on medical amnesties, and how they were using those tools to really intervene with students who maybe needed assistance. We looked at the laws at the state. It's really important for folks who want to do work on medical amnesty that they look at what their laws are in their state. It's also important to look at the county and local level because there may be other laws at the local level that may also be important that you're thinking about when you're working on some of this policy, or if you're working on a law for the state as well. I think it's really important if we're working in higher ed that we really think about each campus is really unique. So, what works at Marshall may not work at another four-year campus, or it may not work at a CTC or another university. So, you really got to look at your own unique campus and start this conversation. I really like the conversation about the having the advisory group and kind of bringing the broad stakeholders together, and those stakeholders should include students with lived experience. And you also need to find your champions on your campus to bring this kind of work forward. So the champions, again, should be made up, I think, of faculty and students. It's important to have both of those groups as you're kind of working on this. Um, if you're going to work on introducing a policy, you've got to learn what that policy is for your campus. So at our campus, our policy was that we worked on drafts of that, and we had to bring that draft to the our board of governors to vote upon. So we had different channels that we had to bring that up and vote upon, and got that actually added to our student code of conduct. So it's important to think about how you're going to move that policy forward with your champions and talk about it, and why it's important. It's good to have, again, some of those conversations if you have students that have been affected by this, bringing them forward with you to tell their stories and to champion this work. I have a link here for our policy on here. And again, these policies are really important. What's important is one, that they're helping intervene so folks will call for help in a medical emergency. They can either call for themselves or they can call for somebody else. Those are kind of the reasons that we have our policy here at Marshall. And then there's another piece of the policy that's really important for us, is that not just intervening in the medical emergency situation, but then on the backside, we also work to recommend the students that they go to one of our counselors and kind of do an assessment to make sure, if they need any other services. So that's really important as well for us to kind of work on. So this is, again, just our policy, so you can see what it has in it. Again, we have the link in here. We can put it in the chat. You can reach out to me if you want to look at what our policy is. But again, it's really to provide some a medical amnesty from them for our students from our student code of conduct if they seek assistance for themselves or somebody else who is experiencing an overdose from alcohol or drugs. Um, it only applies to our student conduct. It doesn't, again, we can't preclude any other law enforcement criminal charges, but it would preclude, but it does, again, help them from being held responsible for our student code of conduct. And the things that we kind of put in ours that we wanted, that we felt were important, was that the person who needed the medical assistance, that they provided some medical assistance information, like where they are, identify the person. If they have any information about the substances that were used, that they provide that information as well, because time is really important. And if they have that information, that they can provide that to the EMS or to law enforcement. We also, again, this is kind of the back piece of it that I was speaking about that's really important. So there's kind of two prongs. Again, one, that you're assisting right away in the medical emergency and getting somebody helped. But on the back side, that we're also working to kind of intervene with the individual. So all students who are seeking medical amnesty, the person who's even calling, we require them to meet with our director, and they can be referred to a substance use specialist or one of our campus counselors. Um, we, also work to not reflect the sanction on their student transcript if they come in and they're seeking medical amnesty policies. We may still contact the parent, and we feel that we had a lot of discussion about that, but we felt like that was important if a student had a substance use disorder and there needed to be some intervention that was happening. So our office student code of conduct can still notify the parents in the event of using a medical amnesty policy. They do keep a record of the incident in our student code of conduct, but once that all the pieces have been kind of taken care of, they work to get rid of that record in our student code of conduct. So these are just some pieces that we all discussed as we went through and we were looking at what would be some of the important pieces to us at Marshall as we were working on our medical amnesty policy. Again, another piece here that is really important that we worked on was if an organization was hosting an event and they called for assistance, then that might mitigate the potential sanctions that could arise against an organization. So we felt that that was really important as well. If they were at an off-campus event, maybe at a party or a Greek party, we wanted folks to be comfortable in as calling out for help so that folks didn't feel like they were going to be charged with the university sanction. Um, I've spoken a lot about our policy and kind of why it's important. And I know that they just mentioned the socio-ecological model, and I have it up here too. It's one of my favorite models as well. But the whole purpose of medical amnesty is really engaging and meeting people where they are. We have those, again, those two-pronged pieces of it. One, we're working to help people who are having a medical emergency and providing assistance and getting assistance to them. But the second piece, the back piece, is really making sure that we're intervening with the person who calls, also the person who is experiencing the medical emergency, so that we're doing some screening with them and seeing if they need some assistance in terms of intervention, getting them into, outpatient services, getting them into inpatient services if needed, but that we're working to really make sure that we're intervening with them, and it's really a teachable moment. I think a lot of people on this call probably are very familiar with the SBIRT model, and this is a very similar model. SBIRT really started in emergency rooms, and physicians were wanting to help individuals who were experiencing trauma because of alcohol use. And so they wanted to get upstream and really not be just working to help people once they experience the trauma from an accident related to alcohol use. They wanted to get upstream and really start to intervene with individuals. So they worked on doing screening, brief intervention, and referral to treatment, and started working to screen people. And so this is really, again, a teachable time where we can really work to kind of intervene with folks who are experiencing substance use. So I've just got a few things on here. Engaging in people where they are, thinking about policies. What campus policies do you have? If you don't have one of these, is this something that you could work to implement? Um, You've got your prevention evidence-based programs on your campuses, screening, um, uh, screening sites that you may be wanting to intervene at on your campuses. Basics is a great evidence-based practices if that campuses can be introducing, and then again, outpatients, inpatient recovery supports. What can we do? And so this is really where I want to talk to you all, educating groups about the importance of Good Samaritan laws, medical amnesty policies, harm reduction. All of those are things that we can be working to do. And really, it's higher education, I think, something that's really important that we do as higher education institutions. We can work to reduce stigma that this is a treatable condition, that we can help people, we can meet them where they are, and again, along that continuum of care, work with them to address, the substance use, or if it's prevention, or if it's treatment or recovery. Um, I put this question on here, should we work with federal groups on a policy? To my knowledge, there's no federal Good Samaritan policy. There are state laws, but to my knowledge, there's not a federal policy. So, is that something that this group should start to think about, to work with federal groups, to work with SAMHSA and NIH and NIDA and some of these groups to think about introducing federal policy, so that we do have um, Good Samaritan laws and policy at the federal level. And then if your local campuses don't have a policy yet, what can you do to help implement that? There are lots of groups in the state who would be happy to help with that. But reach out. There are groups that want to really work to help implement that. And I think it's important too that campuses and communities work together. Don't work in a silo. Community folks can come and work on the campus on a policy, and vice versa. I think that's really important for us to be thinking about as we move forward. And then finally, we need to research and look at the effects of our policies once we implement them. If you're working to implement a Good Samaritan policy, what have been the effects of that? Have you been able to get folks into treatment? Have you been able to intervene? As they were saying earlier, sometimes prevention work is really hard to look at because you're reducing what you're working to reduce often doesn't happen, and so that's really important to have. But we need to be working on researching these policies.
Amy,
That's all.
I'm sorry, go ahead.
That's all I have. I just was going to open it up for questions or.
Well, I'm afraid that we're running a few minutes behind, and I want to give Joanna her time to speak, so we'll have to hold questions for now. But if folks have questions, they can put those in the chat, and we'll get to those if we can. So I'd like to introduce Joanna Vance. She's a person in long-term recovery, and she is a state and national organizer for the Recovery Advocacy Project, and also a member of Mobilize Recovery. Which is a partnership with Faces and Voices of Recovery that you heard us mention earlier today. She's a trainer with the West Virginia Leadership Academy, as well as recovery coaching, a harm reduction pathway. She serves on several executive boards and planning committees here in West Virginia. And if you're doing any advocacy work in West Virginia, you probably encountered Joanna over the last year or so. She's kind of come on to the scene sort of out of nowhere, like, who is this person? And has done a lot in communities over the last year. So welcome, Joanna. We look forward to hearing more about Good Samaritan laws and your project that you're working on to address awareness around Good Samaritan.
Well, thank you, Susie. Okay, so I'm here today to talk to you about the Good Samaritan law here in West Virginia. And I love it when we get to brag on some of our state legislatures. Senator Stallings from Boone has been fighting very vocally against Senate Bill 334 as the harm reduction bill. And he was actually one of the main senators that introduced Senate Bill 419, which was an amendment to our Good Samaritan law in 2014. So this was established, it's called the Overdose Prevention Act, because, you know, the legislature finds that in Good Samaritan policies, citizens, that these policies encourage citizens to seek potentially life-saving medical assistance for themselves or others without having to be worried about disciplinary or punitive actions of an overdose. So that's what this law specifically was, just for overdose. And, well, this amendment to this law. And so an overdose means an acute condition including but not limited to physical illness, coma, mania, hysteria, or death, which is the result of the consumption or use of a controlled substance or alcohol. Medical assistance would mean the professional services provided to a person experiencing an overdose by a healthcare professional, licensed, registered, or nurse, registered or certified under Chapter 30. You just heard about medical amnesty. That's a person who, in good faith and in a timely manner, seeks medical assistance for someone or for himself or herself who is experiencing an overdose, that they may not be cited, arrested, or prosecuted for a violation of drinking in public places, possession of alcoholic liquor, enabling consumption of alcohol by someone who is under the age of 21, delivering or possessing a controlled substance, prohibiting the possession or selling of illegal drug paraphernalia, and this one is really important with collegiate recovery, is distributing to persons under the age of 18 by persons over the age of 21 within 1,000 feet of a school or a college. So basically, this means that if you see someone who is overdosing with alcohol or on substances, or if they're even in like a methamphetamine psychosis, it's covered under that also, that you can, you know how, administer Narcan, stay with that person, call 911. I do want to mention though, like, if it's a party or something like that, while you're still protected under the Good Samaritan law, they're still going to ask you, the officers and stuff, they're still going to ask you for your name, for what kind of substances, who all is there that is underage drinking. And as long as you comply with with the questions of the officers, and like you stay with the person until they come, then you're protected under this law. Like, you won't go to jail for underage consumption. You won't go to jail for possession of a controlled substance or paraphernalia. So you guys are probably, a lot of people are like, why don't we know this? Why do people still go to jail when this happens? Why are people still overdosing and dying and no one calling 911? And why was this bill introduced? Why was this law made in 2014 and we are still here today? People don't know about it. So took on an initiative this year. It was actually Mike Pushkins who gave me the idea last year, and it's called the SAM Project. It's stigma addressed through media. And the very first project is the Good Samaritan Law. This was the first bill I ever got to read, by the way. But the purpose is to bring public awareness to the Good Samaritan Law in hopes of saving more lives from overdose. And the mission statement is to educate the public on the Good Samaritan Law, to break the stigma, and to bridge the gap between overdose situations and calling 911, and to build relationships with law enforcement, first responders, and the community. So this project is being endorsed by the West Virginia Sheriff's Association. We're going to be working with first responders. There's a whole bunch of endorsements, a lot of people. And when I say endorsements, I don't mean like monetary gains or endorsements like that. This is a complete volunteer project. It just means that there's a lot of people in the state that are interested and want to support it because they know that it's important. So what it's going to be is it's going to be a short but an impactful videography of lifelike overdose scenarios that include the importance and role of first responders and law enforcement while highlighting the purpose of the Good Samaritan Law, encouraging everyone to carry naloxone, know the signs of overdose, and not to be afraid of calling 911. Ultimately, educating the public and saving more lives. So we're going to have, it won't be out until summer. I wish I had it to show to you guys today. But also in that, we are going to be, that's going to open up some doors with some of our law enforcement to be able to train them on destigmatizing language and, about their own laws. Hopefully really just bridging that gap between people, because a lot of people are scared to call 911. And then also a lot of officers still arrest people for when they have substances or anything like that in their possession. So I'll just leave it to questions, Susie. That's all I've got.
Thank you, Joanna. So we've got about 3 minutes if folks have questions for either Amy or Joanna. And
I should have mentioned, there is not a federal Good Samaritan overdose law. Amy was right. There are 17 other states, though, that have a law that's similar to ours.
And I put a link in the chat to a website where if you're not in West Virginia, you can go to that website and find the Good Samaritan law if you have one in your state. Do we have any questions? Okay, well, we will take a short break. I'll see if I can figure out how to share some Irish music, and we will be back here in just a few minutes. Thank you, Amy. Thank you, Joanna.